So in the previous video, I discussed about the case of cholesteatoma, the differential diagnosis and the investigations. And now we will go to the plan of surgery in the case of cholesteatoma. So the question will be, what is your plan of surgery? Okay, the plan of surgery is mastoid exploration and meatoplasty. And what type of mastoid exploration? It is canal wall down mastoidectomy. Okay, so the examiner can ask you the question that if cholesteatoma is just limited to attic, then what will your plan of management? Then you should answer that if the cholesteatoma is limited to attic, you can do atticotomy or atticointraostomy. Okay, this is also called small cavity mastoidectomy. So next question is why meatoplasty is done? Meatoplasty is done to provide adequate post-operative drainage and prevent accumulation of discharge post-operatively because we need a pathway of drainage of discharge which collects post-operatively, so meatoplasty is done. And also mastoid obliteration is done. So the aim is not just to do surgery like canal wall down mastoidectomy or atticotomy. The other procedures like meatoplasty and mastoid obliteration are equally important in this case. Okay, next question be, why mastoid is obliterated post-operatively? Okay, to eliminate the dead space, to prevent accumulation of epithelial debris and discharge. Okay, if you in the exam there is a rule that if you say a statement, you have to justify it. So there is always a why and how of all your statements. If you say mastoid obliteration indications or mastoid obliteration importance, they can ask you how is it obliterated, what is the mechanism of obliteration, what you can use in obliteration. The answer is that you can use cartilage, bone pate and bone chips. Bone pate is just finely ground bone dust and bone chips are fragments of cortical bone. Okay, now you can see the difference between both bone pate and bone chips. It is bone pate is finely ground bone dust mixed with blood or saline, as I told you, and bone chips are small fragments of cortical and cortical or cancellous bone. So okay, the next question can be, I think there is some light issue. Okay, what are the advantages of canal wall down over canal wall up mastoidectomy? Why do you don't do canal wall up mastoidectomy? So the answer is that canal wall down procedure gives us better visualization and access to cholesteatoma, and there is also lower recurrence rate in the canal wall down mastoidectomy. Okay, and then the examiner can ask that you have disease, you have removed the cholesteatoma. Now ossicles are also eroded. What will you do of ossicles? So how will you repair the ossicles? You will do ossiculoplasty and you will use incus allograft, and you can also use autograft from the same individual. So okay, other option, what are the other options for ossiculoplasty? These are hydroxyapatite, titanium, Teflon, the combination of hydroxyapatite and titanium, and the combination of hydroxyapatite and Teflon, which is costly, and there is also a chance of extrusion. So this is all today about the surgery done for the cholesteatoma, meatoplasty and mastoid exploration. I hope you liked the video. Thank you.